Good morning, everybody. We're going to go ahead and get started with this morning's Zoom press conference. We welcome you and thank you for joining us today. We appreciate the four major health systems here in Utah who are united and gathered this morning to talk about preparations as COVID-19 cases surge in the state of Utah. We appreciate Intermountain Healthcare, University of Utah Health, HCA MountainStar Health, and Stuart Health in joining us today to share some of our perspectives and thoughts moving forward about our preparation and about what is needed from the community in order to address the growing number of cases here in the state of Utah. Let me introduce the representatives from each of the health systems who will be participating in this morning's press conference. From Intermountain Healthcare, Dr. Mark Briesacker, Chief Physician Executive. From Intermountain Healthcare, Dr. Eddie Stenium, Infectious Diseases Physician. From University of Utah Health, Dr. Thomas Miller, Chief Medical Officer. From HCA MountainStar Health, Dr. Mike Bauman, Chief Medical Officer. And from Stuart Health, Dr. Arlen Jarrett, Chief Medical Officer. Just a few housekeeping items. We will be recording this morning's Zoom press conference and sending out a link if journalists need that afterward. We will go through and have each of the representatives share some of their perspectives and thoughts, and then we'll come back to a Q&A. Today's English-speaking press conference will be followed by a Spanish-speaking press conference with clinicians and physicians from University of Utah Health and Intermountain Healthcare, and that'll be in Spanish only for our Spanish-speaking media outlets today. So again, we thank you for joining us today. We're going to go through with statements from our representatives, and then we'll open it up to Q&A. Reminder that to ask your questions, please use the chat box. We will make sure that all questions that are submitted there are answered. And we also ask that you mute your mics so we can have as much clear reception as possible. With that, we're going to begin, and we're going to start with Dr. Mark Briesacker, Chief Physician Executive from Intermountain Healthcare.
Thank you all for joining us today. The COVID-19 pandemic is changing quickly, and it is requiring our hospitals and health systems to be as nimble as we can be. We are getting close to a capacity of patients that we've not seen or experienced before across our state and across our health systems. Things that we normally really only prepare for when we have emergencies. And unlike those emergencies like a bus accident or a train accident where we can send patients to other hospitals, we foresee a future where that ability to do so will be very much impaired because each of us will be experiencing a growth in patients in our hospitals and especially in our intensive care units. We're deeply concerned about the trajectory of COVID-19 and the number of cases in our state. And we are continuing to see a large number of patients continue to test positive. I know that in Intermountain Healthcare, we have had nearly a record number of positive tests from yesterday. And it would not surprise me to see a very large number from the state today and maybe even an all-time high. Now, we have been working together and we currently have the capacity to care for people. We have been load balancing patients. So within Intermountain, we have had patients who are being treated in emergency rooms at Intermountain Medical Center, and we admit them to LDS Hospital rather than admitting to Intermountain Medical Center. As systems, we participated and worked together last week when we got a call to transfer a patient, and we had all of our transfer centers get together and we determined where was the best place across all of our hospitals to admit that patient. And I'm thankful to Dr. Mike Bauman and HCA who accepted that patient in transfer. We are prepared for a potential surge. We all have plans in place, and we've worked very hard at that. But frankly, it's not a place that we want to go to. We often talk about this and report our capacity and the number of beds, but beds, hospital beds and ICU beds, they do not take care of people. It is the nurses who have experience and specific training, the physicians, the pharmacists, they're the ones who take care of people. And there is a limited number of those talented people across all of our health systems. You know, we realized how hard this was when we watched New York, and this is the reason we sent 100 of our caregivers to New York City to support the health systems there. And we don't want to get to that place. We're encouraged by the governor requiring masks for Utah public schools and students, and we feel strongly that this same requirement and protection is something everyone who lives in Utah and across the Intermountain West deserves. It's critical to do this, along with distancing and hand washing, to keep each other safe and to keep any of us from infecting someone that we don't mean to do. That is not something that I know any of us personally would want to have happen. Having a patchwork approach can and will lead to confusion, and so getting to clarity on this is really important to all of us. So it's really important that the medical community as a whole, that we share this message in a very clear and precise way. And with that, I think I'm looking forward to hearing everyone's comments. I do want to turn it over to Dr. Stenyam to give his perspectives, and then we'll hear from the other health system leaders.
Thanks, Dr. Briesacker. As Mark mentioned, the systems that are here on this call, we have prepared. We have prepared for COVID-19. This has been our singular focus for the past 6 months. We've set up testing sites, we've developed testing protocols, we've developed sophisticated plans for surge and load leveling. This has been our focus for the past 6 months. We are now seeing this surge. We have seen an increase in cases that really started at the end of May and are really continuing today, and likely we'll see this continue to increase given the July 4th holiday, keeping in mind that the cases that we will see from the July 4th holiday will be coming here shortly. This will lead to increased hospitalizations and already on a taxed healthcare system network. Right now, we are managing the surge, but if this surge continues, we will be asking physicians, nurses, respiratory techs, pharmacists, all healthcare providers to take on new roles, to take on seeing patients, managing patients that they may not feel comfortable doing so. We've cross-trained them in this, but it is no substitute for a trained critical care physician or nurse, et cetera. So what we are asking from you is that we need the entire community of Utah to help us with this. Viruses do not respect city boundaries. They do not respect county boundaries. They really will infect all of us and impact all of us, so we need everybody's help. First and foremost, we have to continue to focus on physical distancing. We have to reduce the number of close contacts that we come into contact on a daily basis. This is a tried and true method of combating respiratory viruses, and it should be our main priority. If we cannot do that, if we have to engage with the public, if we have to go out into public spaces, we all need to be wearing masks. Masks have been shown now to decrease the transmission of virus from an infected person or somebody who is asymptomatic and haven't shown symptoms. It is shown also to protect individuals that wear them. In order for us to truly impact the curve of this virus, when we go out in public places, public buildings, or when we gather in social settings that we cannot maintain social distancing, we have to wear masks. And lastly, we can't forget about hand hygiene. Equally important on many of these levels, we have to continue to do hand hygiene, not touch our face, not touch our eyes. But the time to act is now, and we really have to join us as a community and really change the trajectory of this curve.
Thank you, Eddie. Now let's go over to Dr. Tom Miller from the University of Utah.
All right, can all of you hear me? Hi,
Yes,
Dr.
we can hear you,
Tom. All right, thanks, Mark. Appreciate that. I agree with everything that Intermountain says. I'm the Chief Medical Officer for the University of Utah, which has been previously stated. I'm here along with my colleagues, and I want to talk about a pretty simple concept, all things considered, wearing a mask. There's a lot we don't know about COVID-19, how it exactly started, why it impacts some patients in such devastating ways, and why some people can have the virus and remain well. And things like, can the virus really live on surfaces or grocery bags? You know, these questions and issues are pretty difficult to answer, but the really simple part of the equation has always been wearing a mask. So we wear a mask to protect our family members. We wear a mask to protect the vulnerable members of our community. Our parents, our grandparents, our workers, those in schools and situations where they may have some illnesses that predispose them to have a very bad outcome. So the mask is really our best medicine right now, along with physical distancing and hand hygiene. So with the continued and expected rise in cases that we've seen in Utah since late May, what's a little difficult for me to understand as a physician and as a physician who sees firsthand the toll this virus is taking on our state's health systems, why as a state haven't we taken action to come together in a way that we know will actually make a difference? Wearing a mask is a simple solution that actually lowers our case numbers, and it really helps our hospitals from reaching the capacity limits that Mark talked about previously. So I request Utah implement a statewide mask mandate. The infection rate that we see in Utah now finds itself, right now, it's not sustainable for our hospital systems within the next few weeks if we continue on this trajectory. It will be an issue where we're overrun. Studies really have shown that the most effective mitigation that we've talked about previously is wearing masks and distancing. So even though social distancing and hand washing are extremely important, I think masks have been shown to be an effective strategy in stopping the spread of COVID-19, and 23 states have rising cases, and they've also had masking mandates in areas of those states, if not the entire states. So it really is time to act with this very simple solution, and it's time to do it now, not next week, not in August. I think that's too late. I think we've got to mandate this. And every day that we delay masking as a mandate, it takes us one day further away from our goals and raises the risk that we will have an inability to manage a lot of the patients in the hospitals. Now, we really want our kids to go back to school. We want to go back to work. We want our economy to keep running. We know that has to happen. We want to thrive again. We want to travel. We want to feel safe doing normal things. And most importantly, we just want to get together. That's very human. But we won't be able to do any of these safely until we get our COVID-19 cases under control. And that's not going to happen until we enact this very simple solution of a statewide masking mandate. So I'm really requesting that the leaders in our state take this under advisement and move forward to implement a masking mandate. It will help. It really will help. And it will help all the hospital systems manage those patients in dire need of our services as we go forward over the next several weeks. Thank you.
Thank you, Tom. So let's go over to Dr. Mike Bauman, who's the Chief Medical Officer of HCA MountainStar Health. Mike, are you there?
With you about 2 weeks ago about Mask Up Utah.
Start over. They didn't catch the first part of that. We were on mute. So.
Okay. We're having a sound problem. We're going to start over here, guys. So first, Mark, thank you very much for the opportunity to be a part of this and be a part of the rest of the CMO group here speaking with you today. 2 weeks ago, we had the opportunity roughly about that time period to talk about Mask Up Utah. And a lot of what both Tom from the university and Mark from IHC have said, I completely agree with. And it's the same message, but the problem is our message may not have been heard yet. Masking up is a key issue. And as noted earlier, the data are becoming stronger and stronger to support this process. And with that, as has been noted, we need to do this to protect people around us. It's not about so much protecting ourselves as protecting those around us and preventing the spread of the disease. I'll share Tom's sentiment. I think both from a professional as a physician standpoint, as a member of HCA and a member of the Utah healthcare community, I hope we take a much stronger status around masking. I realize in some ways this is a political issue, but without having a balance between a healthy business environment and a healthy population, we won't get through this. So this is not only about having a healthy healthy business environment, it's about maintaining our healthy population. We can't have the businesses that want to be open and be successful without having a healthy population, and masking is part of getting there. As noted earlier, hand hygiene, social distancing, being careful around your family members and others by wearing a mask is key. And We just need to be more assertive about it. Right now, I'm having the perspective of seeing some of my other hospitals in a very tough situation. Right now, as of yesterday, across our system, we had 1,600 COVID positive patients in our system, many of them in Texas, many of them in Florida. Utah is in a great position right now. Although we're seeing a surge, we're not seeing the surge that we're seeing across the country. We have the opportunity, by taking a very simple step, keeping the mask on when you're out in public or in other areas is key. So please mask up. And with that, I'll just simply say Tom and Mark have hit a lot of the key issues. So back to you, Mark.
Really appreciate that. Let's go ahead and go over to Dr. Arlen Jarrett of Stuart Health.
Thanks, Mark. I'll just mention, I'm in my office. The door is closed. I'm all alone. So I'll take my mask off for a minute. But I just want to emphasize that as a healthcare provider, I feel it's my responsibility to set an example. I try to do that in the workplace, wear a mask when people are around. If my door opens to my office and someone knocks in, I'm going to put this mask on immediately. In my neighborhood, when I go to the hardware store, I'm wearing a mask to set an example. And I think it's all of us who feel that this is an important thing ought to do the best we can to set that example. The Stuart Healthcare system, over the past month, we've seen the number of COVID cases in our hospital nearly double. Now, we're not at capacity yet, and we anticipated this rise because, along with the other hospital systems, we've been watching the daily increase in the number of COVID cases. This has been happening since the end of May. We anticipated that our hospitalizations would rise, and we became worried about it. And 2 weeks ago, as has been mentioned, we got together as a coalition of hospitals and made a plea to the public to mask up. We asked the public to do what was responsible, take personal responsibility, and wear their masks, socially distance, use good hygiene. We were hopeful that people would receive that message and act upon it and take personal responsibility. Unfortunately, as the cases have continued to increase, in fact, the numbers that will be coming out from yesterday, we did set a new record at 867 new cases yesterday, according to one report I have in Utah. We're not making the headway that we need to make with the plea to the public to be socially responsible. And it feels as though that we're headed for a disaster. It's very clear that if we stay on this same path, we are going to maximize our hospital's capacities very soon. And unfortunately, our Stuart organization has hospitals in states and cities where they have had a crisis of COVID cases, and we've seen what happens when that occurs. It's unfortunate, and in some ways, it feels like chaos happens. I don't think at this point we can avoid maximizing our hospital's capacity right now. I think the trajectory we've been on for the last 2 weeks, we're going to see more and more cases over the next coming weeks. Even if we didn't see another new case, the hospitalizations will start to catch up, because typically there may be several weeks from the day the test turns positive to the day they end up being in the hospital. So we're yet to see the effects from today's tests in our hospitals, and it seems clear that we're going to be maxing out our hospitals. I think it's probably too late to make that change, but I think it's still in time and early enough that we can avoid the crisis. I agree that we can't wait until August to see what happens. It seems as though some people heard the message that we sent 2 weeks ago, but many did not, or they didn't hear it, or they did hear it and chose not to act upon it. And I'm concerned that what we're waiting for is for the crisis that will compel us all to take this simple step of wearing a mask. I want to lend my voice with the others here today that we all be responsible. And I feel that we need to make a stronger message to the citizens of this state to take this disease seriously. We've had many chances to talk with very pleasant families who brought their loved ones into our hospitals over the past months. And recently, it seems as though there's a common theme among some of the stories that we hear. People at home have not been wearing masks and they have not been socially distancing. Another common theme is that people, when we have a patient such as someone under the age of 40 be admitted and become very ill, they're confused because they've had the false understanding that COVID can't hurt them, but it does. And we see this theme repeated over and over again, and it can be resolved simply by wearing a mask and washing our hands and being socially responsible. That hasn't happened on our own accord and by our own free will. I lend my voice with the request that we make a state mandate immediately and require everyone to wear masks when they're out in public. Back to you, Mark.
Thank you, Arlen. You know, it's fortunate that we have our combined experiences that each of my colleagues brings to bear in our regular meetings to talk about this. I think the message is loud and clear. We are in the eye of the hurricane. The hurricane is approaching. The storm surge is crashing into the beaches. We're raising those hurricane flags today. We as a community, we have to help each other. Let's board up these houses. Let's work together. Let's listen to that mandatory evacuation order. For us, it's wearing the mask, staying socially distanced. And so again, the voice of healthcare, on behalf of all the nurses and physicians and pharmacists who every day are taking care of critically ill patients in our hospitals and our ICUs, we ask that all of you act, and as a state, we act now to begin to take this on directly and clearly. So with that, I know there are some questions, and I will, let's go ahead and start taking some of those. So the first one, I think Eddie is right in your space from being an infectious disease physician. So how do we know about the airborne what do we know about the airborne transmission of the virus? As you know, the World Health Organization received a letter from some 240 scientists over the weekend, last weekend. So what can you share with us about that?
We know in this infection that the predominant form of transmission is through respiratory droplets. So these are the big respiratory droplets we generate when we sing, when we cough, when we sneeze. These droplets usually extend out 6 feet and then fall to the ground. That's the general way we transmit this virus. Now, there has been reports that have shown what's called aerosol transmission. This is where the virus lingers in the air a little bit longer. In order for transmission to occur like this, you really have to have specific environments. You need to have enclosed spaces, long durations of time, and have a group of people or an infected person doing things that really generates airborne viruses. So singing, for example, has been shown to generate these things. But in general, the main respiratory transmission pathways through these droplet particles, which really extend out about 6 feet and then fall to the ground.
Thank you, Eddie. So this next question, I think Dr. Miller, Dr. Baumann, I'd like you both to comment on. So it's about the, how has each of our systems been responding to the increase in patients? And I think what we all know, because we talk about it, that we are having slightly different experiences, and yet in total, we're seeing this increase. So Mike, do you want to start, and then we'll go over to Tom in response to that question. How are we responding?
Sure. First, let's talk about the increases. Fortunately for MountainStar, we have not seen a huge increase, but that doesn't mean we've not been prepared. I'll say our total number of ICU admissions, people in ICU beds, and non-ICU beds are right back to where we were last April when we reached our peak. We're fortunate, though, so far that peak has not been particularly high. Right now, we actually still have about 60% inpatient capacity and 40% ICU capacity. But the problem with those numbers are they can lead to some complacency. We have not been complacent because we see the increase in numbers of patients. All along, we've been preparing about how do we protect our patients, how do we protect our colleagues, and how do we protect our staff. So we've been very careful of screening patients and of screening visitors and screening our staff when they come in the hospital, because without a vibrant, healthy workforce, we won't be able to face what may be coming. and to prevent what may be coming. That's part of why we're here today, is talking about masking. Meantime, in the background, we've had surge plans. So even though I just quoted the number of beds that we are at right now, we have backup plans to increase the number of beds that are available. And we also have ongoing staffing models. Also, being part of a larger system, we can move resources around. So for example, in the last peak around April, we moved some of our equipment and staff down to Las Vegas. We can do that, and those are plans that we're looking at as to how to be able to equip ourselves here in Utah to help our hospitals, but also part of this CMO group working together is talking about what you heard Mark talk about, which is load leveling. How do we in the future, as things get more tight, share the patient burden among the 4 major systems and also be able to help out our rural systems? So in summary, it's preparing and making our staff aware of what's going on, making sure our staff stays healthy, and looking at what we're doing around our bed status. And also last and most importantly, in many ways, is making sure we have all the supplies and equipment to keep our staff safe and our patients safe.
Mike. Tom, please share your experience up at the U.
Yeah, thank you. I'd also like to jump in and on the tail of our discussion about having our leaders in the state ask for mandatory masking. I want to compliment the citizens of Utah because early on we did social distance. People stayed home. They did the right things, and as a consequence, we didn't see a rise in the cases. We know that people have to get back to work, and I think people get fatigued with all of the sort of different things that we need to do to stay safe. But I know that the citizens of Utah will follow our leaders if our leaders ask to mandate the masking. Now, on to the question about what we're doing here at the University of Utah and what we've seen. So back in March and April, we had a level of patient admissions that was what I would call our first tier. Then in April and early May or middle of May, we jumped up and about doubled those numbers to the next tier. And where we are now is what I would call our third tier. And we're able to take care of those patients in the current configuration of ICU beds that we have always had. The next tier, we will be moving into areas that we've consigned to take care of COVID patients that would not be the traditional way that we would manage ICU patients, but it would be in an area where we would keep them safe. We would separate those COVID patients from other patients. So we're close to that. And I know that our other systems are close to that as well. So again, that's why it's so important in the next several weeks to be very aware about the numbers of cases that are rising and to get this mask mandate in place and get messaging out to the community, because Utah's community is responsive and does the right thing when the leaders get behind it.
Thank you, Tom. So I'd like maybe Dr. Senium, Dr. Jarrett to talk about this question. I think it's an important one regarding going back to school. So the question is it safe to allow children to go back to in-person learning in schools in about a month's time? And maybe, Eddie, you could start, and then Arlen, you could provide your perspective.
Yeah, what I would hope is that the leaders in our education make decisions based on data. If we continue to have a rise in cases like we are having currently and are projected to do for at least the next couple of weeks, and that rise takes us into August, I don't think it would be safe. In order for us to even consider going back safely to school, we're going to need to see a control of this pandemic here in Utah and declining case counts. And until we see declining case counts and a really good control of this pandemic, I think it's going to be really hard for us to send our children back to school full time in a safe and effective manner. And if those case counts continue to go up, we're going to have to wrestle with what that looks like, and whether that's going to be tele-learning or a modified structure in our school system. I just hope that our leaders would really focus on the data that leads us into August to make those decisions about going back to school.
And Arlen, your perspective on that?
Sure, thanks, Mark. Yeah, I agree that we need to follow what's happening at the moment, and it's sometimes difficult to predict today what our response should be a month from now, because we don't know what will be happening a month from now. So I agree with Dr. Stenham on that. I wish I knew, and I wish others knew, is it safe for children to go back to school? and when is it safe? I wish we had the hard, firm answer to that. I do know that by many reports, distance learning was not a very successful experiment at the end of the last school year. Some may have had some success, but I know many struggled with that. And unfortunately probably hit certain socioeconomic demographics of our society differently than others. And what I am concerned about, along with the transmission and spread of disease, I'm concerned about the generation of children who need to be educated. So clearly we have to weigh a decision about whether the children go back to school or not very carefully about what it's doing to their development and their both intellectual and physical and psychosocial development. I would certainly hope and expect that the schools will take, if we do reconvene students in the classroom, that they'll be able to have the resources and tools at their fingertips to socially distance and to do the things that we're asking people to do right now. I know it's difficult for children to wear masks and stay apart from each other. That will always be a challenge, but we can do our best and make our efforts be guided by what we know about how this disease is spread. We know children can get and spread this disease. We also know that in general, they're not as at risk for dying from the disease as older people are. That doesn't mean they can't bring it home and spread it. So we have to go into this very thoughtful, and I wish I knew the answer.
Thank you,
Also
Arlen.
to protect our teachers.
Yeah, you're right, Tom. So the
question from Robert Gerke of the
Yeah,
Tribune.
that's exactly where I was going. I think it's a really important question from Mr. Gerke, and it speaks to the bed capacity and what does it mean. And we as a group have been talking about this for a couple of weeks. I think I'll start and then ask others to comment.
Mark, you want to read the question?
Yeah. Thank you, Josh. So the question is, let's see, there it is. So people see the utilization rate on the state's website, generally around 50%, and it's inconsistent with the warning we're giving today. So how would you explain this to people who question the alarm? Let's just start with that. So when you look at, the report today shows every hospital bed and every ICU. When we look at the referral ICU beds that we have across our systems, the rate of people, Utahns who are in those ICU beds today is in the low 70s. It's 72%. Within our system, within Intermountain Healthcare and our referral ICU beds, we're at 77% full. Once you get to 80 to 85%, that's when the pressure and stress begins to occur. You always want to keep a bed open for the next person who's really sick. They're sick from a heart attack. They're sick because they've had a stroke. They're critically ill because they were in a motor vehicle accident. And so once you get to 80 to 85%, you are full. And we are approaching that. As a healthcare system, combined healthcare systems, we are at 72% today. So this is why it's just so important. We also know that it's going to be important for everyone to be seeing that type of information, and we're working with the state to produce a report that will show that on a daily basis. And I'm thankful for my colleagues because we work diligently on this, and I think we're really thoughtful about identifying which of our hospitals are those referral centers, the referral centers for our rural facilities, the referral centers from within any given county. And that's going to be the point that we cannot pass. So Robert, I hope that answers your question. And I think there's a second part here. Yeah, go ahead, Tom, and then maybe I'd like to hear from.
Yeah, I think that
Arlen
the data that the question asked about is not representative practically of what's going on, which is what Mark is saying. And I would ask us all to just look across our border into Arizona and California and also understand that per capita we have fewer IC beds per individuals in the state than other states. And what is happening in Arizona and California and Texas will happen here if we don't mitigate in ways that we discussed earlier. So I don't think that the data that is being shown currently represents accurately what is really happening in our centers. And so back to Mark on that.
Thank you. Mike, let's go over to you on because I want to have your thoughts on this be heard.
Sure. Thank you, Mark. As Mark mentioned earlier, we've been looking at how the data may actually, as importantly and transparently, tell the real situation. And as we discussed in a meeting yesterday of the CMO group that you're seeing now, there were concerns about this concept of referral centers. And just to flesh that out briefly, those are the hospitals that we send our patients to, or others send to us, with those ICUs that are more likely to become full more quickly. So in my sphere of the world of HCA and MountainStar, those hospitals are, St. Mark's, Ogden, and Timpanogos. But I have other hospitals that are also referral centers for the rural areas. So understanding how full they are is very important. And even though, as I mentioned earlier, currently now we're having capacity, we can be lulled into a sense of complacency if we're not preparing. And that's part of what this news conference is about today, is starting to flatten that curve. And that's been much overused, I think, but it's really flattening the number of cases and being able to mask up. So even though we have capacity now, we could very quickly move. And I'll use the example again from, my experience. Our hospitals in Florida, a week and a half to 2 weeks ago, had a similar capacity to what we have now. But they very rapidly got into trouble over the last 2 weeks. I don't want to see Utah get into that problem. And we can help prevent that problem by doing the basics like we've talked about already, masking. But one of the bigger and more challenging areas is the ICU space. And I'm a little bit passionate about it because in the background, I am an ICU doctor, although I went, as some of my friends said, to the dark side. I'm now an administrator, but ICU is where my passion was for 30 years. We need to be very careful with that resource because it can be filled very quickly. And one of our challenges is when COVID patients get into the ICU, we know they have a longer length of stay in the ICU than other ICU patients. So not only is it filling a bed, it's filling a bed for a much longer time, which makes it harder for the other patients, the stroke patient, the heart attack patient, to get in and get the care they need. So circling back, knowing where our referral ICU beds are under stress is very important. And we need to be sure people who use this database called the DOMO database understand there's much more to those bed numbers than simple bed numbers. It's understanding how quickly we're changing, how we staff those beds, and outside in the public-facing world, taking the steps we need to take to prevent further transmission and growth of not only patients in the ICU, but in the hospitals.
Thank you, Mike. Going back to that point that beds don't deliver care, people deliver care. Eddie, there's a couple questions on here about how
Mark,
long it might take.
Mark,
Yeah, Arlen, go ahead.
Can I respond to that? Sorry, Arlen, Jarrett.
Please,
Hey,
please.
so I don't want to embarrass Robert, but Robert, your question was just right to the point. This group of CMO physicians that you have on this call right now, we meet together twice weekly for sometimes more than an hour at a time. And our last 3 meetings have been consumed on this very question that you asked. And we've been looking at the state report and how it's not sending quite the message that we are all feeling internally. And I think you've heard some explanations about how we're trying to change that. There are ICUs in the state that are excellent ICUs for taking care of certain people who need to be monitored very, very carefully and very, very closely. But they may not be the ICU where a very sick COVID patient needs to go. And we're needing to take that into consideration, as Mark mentioned. We're working on preparing a new graph, a new chart that will go to these data dashboards that can tell this story a little bit better. Back to you, Mark. Sorry for the interruption.
Thank you, Arlen. No, much appreciated. So there's a couple of, I think, infectious disease questions here, Eddie, that I want you to take on in rapid fashion. Let's start with, so how long might it take for the effects of a mask mandate to be seen? So what period of time until we start to see the daily case counts come down?
I would say simply 2 weeks. Incubation period of the virus is 5 to 14 days. If we all started wearing masks today and doing better physical distancing, we'd see that number decrease in 2 weeks.
you've mentioned, we've all shared, it's physical distancing, it's hand hygiene, washing our hands, it's wearing the mask. Are there any other things beyond those things that we can do to help stop the spread?
Yeah, so any kind of respiratory virus pandemic, you think about treatment options, and that's medications, antivirals. We don't have any of those yet that we can use in a mass quantity. So then you look at prevention ways to do that, and that is vaccines. We don't have a vaccine. The science of that is evolving rapidly. We hope to have a vaccine in the next 6 to 12 months. And then after vaccines, it's public policy. And so public policy includes physical distancing, wearing a mask, and washing your hands. And so without a vaccine, without a therapeutic, we're left with public policy measures, which include masking, physical distancing, and hand washing.
And then the last one in rapid fashion here, where's the exposure happening in our communities? Is it at work? Is it at home? What's the latest on that?
When we look at the Utah Department of Health website and we look at the results of their contact tracings, where people are getting this infection, many of them are getting them from known contacts. They may not have been known contacts when they were interacting with them, but they subsequently went on to have COVID-19 and they've received it from them. And then a large group, which is what we're seeing increasing, are those that are unknown sources of infection. Those unknown sources are likely coming from the community, from places that we interact in, businesses, public places, and in social gatherings where we don't know somebody's infected. So that's the biggest increasing segment right now, which goes with increasing community transmission.
Thank you. I'll take one that's also really quick from Paul Nelson. The state set up a large number of beds inside the Mountain America Expo Center. Do doctors still have access to these beds to prevent hospitals from becoming overwhelmed? The Expo Center is part of the statewide surge plan. I would just remind everyone, beds do not take care of patients, people do. And that's really what we're talking about here. So we don't want to use the Mountain America Expo Center. We're thankful that all of us together and with the state have prepared diligently for whatever may come, but we must not get to that point. Let's see. Another question here.
John Reed.
John Reed. Okay. Oh, we just addressed that. So thank you, John, for that question.
Question from Greg.
Yeah, we did that one as well. So let's actually take this next one on. So, why do you believe that this has become a political issue, and how do you hope to cut through the back and forth on the issue? Look, we applaud the governor for the steps he took yesterday to mandate masks for kids, and the very clear challenge that he gave. The way that we cut through it is we just keep working together. We work together as CMOs. We work with state leaders, business leaders, faith leaders. We listen to all of you. We dig in and hear what people need, and we try to solve for the situation and for the challenge. The challenge we have today is this is rapidly evolving. We're going to have an all-time high today in new cases. Some of those who are diagnosed today in a couple of days are going to be in our hospitals. And we are at that point where we need to act now. So that's how we cut through it. We continue the conversation, we work together, and then we act. Okay, are there any other questions, Jess, that you've seen that we haven't taken?
No. Any other questions from the media? Go ahead and enter those into the chat box and we'll get those answered. We'll give you a minute
Mark,
to do
can
that.
I make a quick comment on the last bit?
Please.
It's, as Mark said, a very important thing to be working together. And I think some of the politics are the balance between the important and very vital issues around business, but then it's also the balance with what do we need for a healthy population in healthcare. But really, without a healthy population, you can't have a healthy business environment. And part of getting to that healthy business environment is having that healthy population, and part of that is wearing a mask. And I hope those that are watching and listening will understand that, because we don't want to cross that threshold that has been described so far across actually all four of us, that we need to be very careful and take a very simple step. We need to mask up, and both from a personal, a professional, and from working for a healthcare company, we really need to move to masking. And if that takes a mandate, hopefully we'll get to that sooner than later.
I think there's one other question that I just remembered, and it had to do with what has been the impact of the increasing cases on our testing capacity. The impact has been, as more and more people need to be tested, that puts the very same strain on the testing sites and labs. And this is also something that we talk about as a group. And of course, we have the state work group on testing that is very active in this space and providing great guidance as well. Everyone is responding to continue to grow capacity, to continue to work on who are the right people to test and when. And we're all working on and evaluating new ways to test people that hopefully can make the testing process easier for patients and families and easier for us to administer across the healthcare systems. Yeah, so I see one last one from Robert on perhaps, we can talk about the strain on doctors and nurses. And Robert, thank you for asking that question. People are working really hard, and it can be disheartening to go to work every day and have so many patients to care for, to have to care for them, knowing that family members can't visit and trying to keep everyone connected and communicating with each other. And then to be driving home and to see people not wearing masks, not staying 6 feet apart is extraordinarily disheartening for people, frankly, that are putting their health and well-being on the line every day and putting on personal protective equipment to care for critically ill patients, to see patients who are sick but we don't know what they have in our EDs, in our Instacares, and in our primary care clinics. We know from our experience in New York that this pandemic takes a tremendous toll on healthcare workers. We're concerned about that. We're concerned about their well-being. We talk about it a lot, and we provide the support that our caregivers need to weather this pandemic. So again, on behalf of every nurse, every pharmacist, every physician, every healthcare worker across our state, we ask all of you to act now and do the things we need to do to avoid this tsunami of cases that we are just facing all together at this point.
Mark, one last question. Takeaway for all the participants today. It seems that mask wearing has become political. What would our clinicians say to those that it is a political issue and a right or liberty not to wear a mask? And we'll end it with that. Let's go through all the participants. And let's start with Dr. Miller, and then we'll go to Dr. Jarrett, Dr. Bauman, Dr. Briesacker, and finally Dr. Stenium, to your response to that to close it out.
Yeah, thank you. So the number one thing is with this mandate is also not to blame. I think, when we look at those who aren't wearing masks, we need to understand that there are many different reasons that at that moment they may not be wearing a mask. So not to get angry, not to be upset, but to really try to use our best reasoning skills to get people to wear masks. And that's why it's so darn important for our leaders to sort of, what I call this as being a mask missionary, to wear masks, to get people to sort of buy in over time, not to blame, and to move the culture along through understanding. And I think that's really the best way to get this across the line. We understand the tension that's out there with people not, having to come back to work, and they're suddenly realizing that they're not sick, but they are suffering because they can't pay a mortgage or they can't put food on the table. That adds to their frustration and their anger. And then they maybe look and blame others for being asked to wear masks. But again, I think we just need to model this behavior in a blame-free way and move forward. And I think that will win the day. Again, as I said before, I really applaud Utah's citizens and society, and I think we can get through this. And I think by messaging, being strong on the issue, we can get it done. And we can get those case rates down within the next couple of weeks if we really get after this.
So thanks. This is interesting. Last weekend, I got away from work a little bit and spent some extended one-on-one time with a family member of mine who was very strongly and firmly planted in the political position that it was his right to not wear a mask. And one thing I learned from that experience this weekend was that no amount of my preaching from my soapbox was going to change his mind. I couldn't browbeat him into submission, and it only made him stronger in his belief. And I don't know exactly the best way to win over, but I do know that probably the thing that will happen that will be the most effective is if people get touched in some personal way. And I just really hope that people don't have to be touched in a personal way where they lose a loved one or have someone get sick because of their position on this, and then their heart is touched and they change. I hope that people's hearts can be touched and minds can be touched by hearing the stories, and that's what we're trying to put out here today, is just hearing from a handful of very diverse organizations. We all do things very differently here, but we're all coming together with the same theme, the same message, the same ask. Please, it's so simple. You know, when you go into the operating room, you expect your surgeon to wear a mask. You would never expect him to not wear a mask when he's operating on you, he or she's operating on you. And it's just such a simple thing to us people in the medical profession. It's hard for us to understand how it's become so political, but we hope we can touch people's hearts.
Dr. Bauman.
So I'll jump in now and I'll say, actually, I very much like what Tom said about this should not be a blame game. And actually what Arlen said, it's the personal stories and the personal touch that really makes the difference. And although it's easy to say it's not politics, it's about healthcare, which is something I talk about maybe too often. It's really about helping each other and protecting each other. But it has been such a political football, it's tough. I like the analogy that Mark used earlier. This is like wearing a seatbelt, and that was during the Mask Utah discussion. And then the analogy I use, because I'm a pulmonary guy as well as critical care, it's like being on an airplane where nobody smokes anymore. It's about everybody's health around you. It's easy to say, but tough to do. And I think Arlen hit the nail on the head. It's about those personal stories. So right now, for the second time in 4 weeks, my mother-in-law has had a repeat hip fracture. She's in an extended care facility. And I really appreciate everything that's going on around her because we're protecting her, the staff are protecting her. We need that same level of care and interest that occurs in a healthcare system to be in our community. And hopefully we won't need a mandate, but if we do need a mandate, I think we need to get there because it's all about protecting each other.
Thanks, Mike.
Dr. Breesacker?
So I think I don't view this as a political question. This is about people. Our country started with the words, we the people. And when we come together in these moments, whether it's a natural disaster or a worldwide conflict, and all the many events that we've experienced in our state and across our country, we come together. And it is that foundation, that spirit, that creates the rights and freedoms that we then enjoy. And so this is the time for us to come together to do the things we've talked about today. That's the way that we will get ahead of this and be in the right place and be the leaders that this state has come to enjoy from a position across the country. So it's not political. It really gets down to our core of who we are. It's about people.
And finally, Dr. Stadium.
Yeah, I really wish, as a practicing clinician, I could take people into the hospital and walk through the ICU and listen to the ventilator and all the beeps and talk to our healthcare professionals who are caring for these people and talk to the patients and realize how scared they are. They're alone. It's hard to communicate with their family due to the noise in the ICU or if they're on a ventilator, or see the husband and wife that are in rooms next to each other because they've been infected by this. This morning we rounded on 47 patients with COVID in Intermountain Medical Center. And I think just walking the halls and talking to the patients and talking to our caregivers and understanding how tired they are and how scared they are of what is to come would change anybody's mind. And to know that this virus doesn't respect political, party lines. This virus affects the community, and seeing that firsthand, like Arlen talked about, seeing the emotion behind it, it's not subtle. You want to do everything you can do to prevent this infection, and that includes following these guidelines and includes wearing a mask.
Again, we thank all of our participants today, and we thank our health systems for unifying and speaking out about this issue. University of Utah Health, MountainStar Health, Stuart Health, and Intermountain Healthcare. That concludes today's press conference. A reminder, we will be doing a Spanish-speaking press conference starting in 5 minutes for Spanish-speaking media. Thank you so much for joining us, and have a good day.